Hi, my name's Maddy Bass. I'm Director of Nursing and Quality here at St John's Hospice, which I've been doing for 6 years, and I feel really privileged to have that post. I've worked in palliative care services for 24 years now, as a hospice nurse, as a Macmillan nurse, and in management and in education. And I want to talk today about how to have difficult conversations with families. It's something that you will be doing every day, and we know that communication is really important. And it's a model that I've used many times with patients and families, and also when I've been managing staff. So it's a useful model to apply. It's called the SPIKES model, and it's SPIKES. It's a model that was originally designed for breaking bad news, but it's a model I think that you can transfer to various situations. Each of those letters stands for a different thing to remember. And for me, I find that's really helpful when I'm thinking about having a difficult meeting with somebody. So the first S stands for setting up the meeting. So if you know you need to have a conversation with families ahead, then it's useful to think of where you can have it where you won't be disturbed. Try and get your mind together about the sorts of things you need to talk about, how you might word it, and what questions might be anticipated. Sometimes you can't always set up a meeting. Sometimes people bombard you and they need to speak to you. So in that situation, it's always good to ask them to move somewhere else. Right, we need a conversation. You're obviously angry, or there's things we need to talk about. Let's come and sit in this room, this office. Get them to sit down and then ask them if they want a drink. Can I get you something to drink? It usually buys you a little bit of time just to get your head together, find somewhere for them, and think about what you're going to say. That's your setup. The main thing to remember in this is try not to be disturbed as much as possible. When I worked as a palliative care nurse specialist, I had a pager. And I used to say to people, my pager may go off, and if it's a certain number, I may need to leave and take a call, but I will try and stay with you. So I anticipate that might happen and let people know. So that's the S. P is for the patient's or the person's perception. Do they know what's going on? And a really good way of accessing this and finding this out is just saying to them, tell me what you know about what's going on. Tell me what you've been told. Get their idea of what they know of what's going on. So the interesting thing about that is quite often when I'm working with people and I'll say, so staff member or family, bring me up to speed with what you know about what's happening at the moment. And quite often they don't know that there's been a scan result, a blood result. Sometimes we rely on our patients to tell their families what's going on, and quite often they don't, or they give their own idea of what's going on and they don't really know. So that gives you the starting point of what people know. And sometimes it's a lot more than we anticipate, and sometimes it's not. So that's the setting up the meeting and the perception. So the next letter is I, and that's invitation. So you're asking people whether they really want to know what's going on. So if you're dealing with a patient, do they want to know their diagnosis and prognosis? If you're dealing with family, do they want to know the full picture of what's going on? Bearing in mind, don't forget, if the patient's got capacity, you have to ask their permission. So a really good phrase is, are you the sort of person that likes to know what's going on? And that's a phrase I've used a lot of times with patients and families, because sometimes people are angry, but they're worried about the information they're going to hear. And in that situation, you can invite other people to be told instead, or other people to be with them and arrange another time. So that's the I, that's the invitation. Then you come to the K, and the K stands for knowledge. So this is where you're telling people what's going on, you're updating them. And depending on what you're telling them, remember, this could be bad news. It doesn't have to be diagnosis and prognosis that are the only things that are bad news. It could be the fact that people can't go home, or actually people do have to go home, or they can't have this medication, or you can't get carers. Those are the kinds of things that can really impact on people. So a good way of dealing with this, and I'm coming from a diagnosis point of view now, is a warning shot. So this is giving people the chance to come to terms with that difficult information of that they might have, say, cancer. So rather than coming out and saying, I'm going to tell you you've got cancer, it's, we did a CT scan, we found that there was a lump, that's another warning shot. Unfortunately, the lump looks like it's a growth, and that's another warning shot. The growth means it's a tumour, another warning shot. The tumour means that it's cancer. And each time you're pausing between to let that information sink in, and all of those steps are warning shots. And they're a good way of imparting difficult information. So it could be, we know you want to go home. That has been quite difficult for us. And I'm afraid that we've not been able to sort it out in the way that you'd hoped. And this means that you can't go home. They're all useful things to talk about. So that's K. But along with K comes emotion, and that's the E of spikes. And that's recognizing that when people hear situations either that might be good or might be bad, often it means they have to think about the whole situation differently. They have to rethink things. They might be very upset. They might be relieved. They might be angry. And those are the emotions that are normal emotions. It doesn't mean you can't cope with that situation. You just have to be ready to accept that that's part of the process of communication. And just remain calm. When people are angry, just acknowledge they're angry. I can see you really angry. What's making you angry? What other information will help? And some people may storm off, and that's absolutely fine. Just let them do it and say, I'm ready when you're ready. Come back when you're ready. Just accept that emotion is part of life. So that's the E. And then the S is strategy and summary. Now that sounds quite formal, but what you want to make sure is that there's a next step. So if you had a difficult conversation with the family, the next step might be, okay, this is my number, or let's meet in 2 days' time, or why don't you go away and think about it and come back to me with any questions? But don't leave people hanging. Never just walk away and say, thanks for your time, that's it. People will come back with questions, and people need to know, as you need to know if you've made a complaint about something, that that's not the end of it, that you will have a resolution or a next step. And that's really important. So SPIKES. I hope that's helpful. It's certainly helped me over the years. And, we're still here. Let us know if you need help. Thank you.